Hello, welcome to Advancing Health Literacy, Improving Self-Management and Empowerment for Clinical Settings. This is the second in a series of trainings brought to you by the New Haven Heal Initiative. The New Haven Heal Initiative aims to improve health outcomes for New Haven residents, to reduce COVID-related disparities, and to increase patient engagement in their healthcare. To refresh your memory, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. In our most recent training, we went over how to assess, select, and create easy to understand materials, how to use health education material effectively, and how to welcome patients. During today's training, we'll be going over a few tools you can use to improve self-management and empowerment at your organization. Tool number 14 is encouraging questions. Patients are sometimes embarrassed to ask questions, and, in some cultures, deference to authority stifles questions. Creating a shame-free environment that encourages patients to ask questions is an important way to engage patients as active partners in their healthcare and is crucial in promoting patient safety and good health outcomes. It can also increase patient satisfaction and reduce the number of callbacks after a patient leaves. First, invite questions. Encourage patients to ask questions can be as simple as saying, "What questions do you have?" This specific wording creates the expectation that they should ask questions. Do not ask patients, "Do you have any questions?" because most patients will respond to this wording by saying no, even if they do have questions. Ask patients what questions they have several times during an office visit. Use body language to invite questions. Sit, don't stand. Sit at the same level as your patient. Look and listen. Look at patients when talking and listening, as opposed to looking at the chart or computer. Show that you have the time. Be conscious about presenting yourself as having time and wanting to listen to their questions. Try not to interrupt. Help patients prioritize questions. If patients have a long list of questions, help them decide which ones are most important to address at this visit. Have them schedule another visit to address the rest of their questions. Encourage all staff to make sure questions are asked and answered. Check-in and rooming staff can encourage patients to ask their clinicians any questions they have during the visit. Checkout staff can ask patients whether all of their questions were answered. Make sure you have a plan for how to respond if a patient says no. Remind patients to bring questions with them. Appointment reminders can suggest patients bring a written list of questions with them. Checkout staff can suggest patients write down questions that occur to them after they leave so they can ask them at the next visit. Encourage patients to ask questions in other health settings. For example, when giving a patient a new prescription, you might say, "Be sure to ask the pharmacist if you think of any additional questions about your medicine." Track your progress and remember to use these three resources: the Teachback method, Ask Me 3, and Questions Are the Answer. Tool number 15 is making action plans. An action plan, created together by the patient and clinician, outlines one or more easy steps a patient can take to attain a health goal, such as losing weight or improving self-management of a chronic condition. This tool will guide clinicians through the process of creating and using action plans in collaboration with their patients. First, watch an action plan video. Search online for the 6-minute American College of Physicians Foundation video, which shows 3 examples of patients and clinicians creating action plans for management of diabetes. Create action plans with patients. Ask permission to talk about health behaviors. For example, would it be okay if we talked about improving your blood sugar level? Determine motivation. Does the patient express the motivation to change? If patients do not show interest in making changes, explore what barriers might stand in their way and what they see as possible benefits of changing their lifestyle. Have patients choose the goals. In order for the plan to be successful, the goal must be important to the patient, and he or she must be motivated to change. Ask patients what matters to you. Have a list of goals to give patients ideas on what they could work on and help them decide on changes they are motivated to make. Help patients break down goals into manageable steps. Have patients pick one specific step they are likely to do. Steps should be small and realistic to do over a short time, such as 1 week. Fill out an action plan form. Use a form to outline exactly what the patient will do. Keep language preferences in mind. Assess confidence. Assess the patient's confidence by asking, on a scale of 1 to 10, how sure are you that you can follow this action plan? Research shows that a confidence level of 7 or above increases the likelihood that the patient will carry out the plan. If they are not, the clinician and patient should explore ways to revise the plan so the patient feels more confident. Identify barriers. Ask the patient what might stop you from following this action plan. Problem solve about how to overcome barriers. Make a copy of the action plan. Give a copy to the patient and place a copy in the patient's medical record. Follow up after the visit. Follow up lets patients know that you are interested in helping them achieve behavior change. Ideally, set up a time to follow up a week or two after the patient's visit. If the goal wasn't met, help patients develop a plan that can be achieved. If the goal was achieved, celebration and praise are in order. Update the medical record to reflect the current plan the patient is following. Remember to track your progress. Tool number 16 is helping patients remember how and when to take their medicine. Research has shown that patients often have difficulty knowing how and when to take their medicines, especially if their routines are complex. Patients with limited health literacy tend to have particular difficulty taking medicines accurately. Helping patients understand and remember what medicines they need and how to take them can reduce errors. Ask patients how they remember to take their medicines. You might say, everyone forgets to take their medicine from time to time. When was the last time you forgot to take any of your medicine? Provide patients with a list of medicines. You can always make edits to documents to provide patients with simple documentation of what medicine to take and when to take it. If you have an electronic health record, explore whether it can produce a medicine list that patients can easily understand. Anticipate and prevent errors. Consider purchasing online reminder tools. There are a number of commercially available tools that include features such as listing the medicines with simple explanations of what each medicine is for, audiovisual tutorials, or sending email or text message reminders to patients. Always write prescriptions that include precise instructions for taking the medicine. For example, instead of writing twice daily, write take 1 pill in the morning and 1 pill at bedtime. Include a plain language description of what the prescription is for, such as high blood pressure. Warn patients about possible changes in the color, shape, and size of the pills. Make patients aware that color, shape, and size of pills may change when they refill prescriptions. Reassure them that, As long as the name of the medicine and the dose are the same as what they are used to taking, their medicine will work the same way and should be taken as originally directed. Make it easy. Provide pill boxes. Teach patients and caregivers how to fill a pill box using their medicine list as a guide. Enlist help from family members. Family members can play an important role in reminding patients to take medicines or setting up and filling pill boxes. Advertise ways you can help. Tell patients that you can help them set up reminder strategies such as pill boxes and medicine lists. Synchronize refills. Whenever possible, set up refills for multiple medicines so they occur at the same time of the month. Document reminder strategies. Make sure the patient's reminder strategies are documented in their medical record. Tool number 17 is getting patient feedback. Frequently, practices are unaware of the level of difficulty patients encounter in reading or completing forms, understanding health information, and navigating the healthcare system. Patients are in the best position to judge if a medical office poses health literacy challenges. Getting patient feedback can highlight features of your practice that may cause difficulty for patients and help you identify areas for improvement. Choose from among the following ways to get patient feedback. Use multiple methods of gathering patient feedback will improve the caliber of the information you receive. First, shadow patients. Have a staff member shadow patients. A staff member can accompany a patient during a visit as a quiet observer. Shadowing can provide valuable insight into how a patient experiences your practice flow and communication. Decide how many patients you want to shadow and the time frame within which you would like to complete the shadowing. Select patients to shadow who are representative of your practice in terms of age, gender, race, ethnicity, language, and health issues. When shadowing patients, stay with them from the time they check in until they leave. Consider arranging to meet them outside your practice to see how easy it is to find your practice entrance and check-in desk. At the end of the visit, ask the patient what went well and what was difficult about the visit. Conduct a walkthrough. Have a person unfamiliar with the practice walk through it with a staff member and give feedback on the signage and the physical environment. Be sure that anyone who conducts a walkthrough will not observe any private or confidential interactions. Consider recruiting a student from a local adult education program to conduct a walkthrough. Observe patients using your patient portal. If you have a patient portal, ask several patients if you may observe while they use the portal. Try to include patients who are not very experienced using computers. After you let them explore the portal, ask them to complete a specific task, such as look up their recent lab results. Ask them to describe what they are doing. Observing patients use the portal will help you know where changes in appearance, wording, organization, or navigation of the portal may be needed. Ask patients for feedback on forms or other materials. While a patient or a family caregiver waits for a visit, or at the end of the visit, ask him or her for feedback on how understandable your written materials are. Remember to evaluate materials you did not develop as well as materials you created. Try a suggestion box. Let patients and caregivers know you want to hear from them about any difficulties they have understanding information they have been given or getting the help they need. Survey your patients. You can gain valuable insight from patients by conducting a survey. There are 5 main decisions to make when surveying patients. Choose a survey tool. There are a number of surveys you can choose. Choose a patient population to survey. How you choose the patients to survey can impact the feedback you receive. Choose how many patients to survey. There is no set number of completed surveys that will automatically provide you with a reliable source of information. Generally, though, obtaining 50 completed surveys will give you a good idea of how your practice is doing. The larger the number of patients who respond to your survey, however, the more confident you can be in your results. Choose how to administer the survey. Administering surveys by having someone ask the questions on the phone or in person may make participating easier for patients with limited health literacy skills. A web-based or tablet-based version of your survey can help you collect and analyze survey data and may provide audio options to address literacy barriers. Use a cover letter to introduce and explain the purpose of the survey to your patients. Regardless of how you collect data, patients are more likely to be honest if they know that their responses will be kept confidential. Choose how to analyze survey results. Staff can create a spreadsheet and enter survey responses into it. Then you can total the number of low and high ratings to help you understand your survey findings. After surveying, act on your results. Bring aggregated results back to your health literacy team when you have finished obtaining patient feedback. Collect patient feedback as a routine part of your quality improvement services. Obtaining patient feedback is not a one-time activity. It should be done on a routine basis. Consider obtaining feedback from a sample of patients every quarter. As always, track your progress. This concludes today's training on improving self-management and empowerment. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative, led by the New Haven Health Department. Join us for our final training coming soon on improving supportive systems.